preeclampsia is a serious and sometimes sudden pregnancy complication that can put both mothers and their babies at risk. And in many cases, the warning signs aren't caught early enough. But there's new legislation and emerging technology that could help change that. Lia Butler is the Director of Sales, Marketing, and Business Development for NeoPredics and brings both professional insight and a deeply personal experience with this condition. We say good morning to you, Lia.
Good morning. Thank you for having me.
Thank you. It's good to have you on. Tell us about preeclampsia. What is it and how common is it?
Yeah, so preeclampsia is a hypertensive disorder of pregnancy, meaning it's characterized by high blood pressure and some impact on your organs, so your kidneys and your liver, and it's a deadly condition. The only cure for preeclampsia is delivery, and while it can be monitored and managed when it's not a severe form of preeclampsia, it always progresses to severe after some time. And it puts the mother and child at severe risk for things like maternal mortality and morbidity, and then lifelong health consequences. It's incredibly common. We know that the numbers are rising, and we don't quite know why, but many women are experiencing preeclampsia and severe features. And we're not doing anything as the healthcare system isn't doing much to combat those numbers, which is why in the United States, we have one of the highest maternal morbidity and mortality rates in all of the developed world.
That's fascinating. Could it have anything to do with age? Are women having babies older? Is there any link to that?
Yeah. Advanced maternal age is definitely one of the things that contribute or are a potential contributor to preeclampsia. I think there are many factors. It might be lifestyle factors. We know that preeclampsia has been on the rise even since 2020. So sometimes I suspect that maybe a more sedentary lifestyle is a cause. But I think it's multifactorial. And that's another reason why it's so hard to identify who is going to, go on to get preeclampsia, because there are just so many things that could really contribute.
And who knows what COVID and the COVID shot and everything else. I mean, there's a million and one thoughts. I'm not trying to link. I have no idea, obviously,
Yeah,
but I'm
no,
just
we
saying
just don't
we
know.
don't know. Yeah, we don't know at
Yep.
this point. Now, you had a personal story and your diagnosis for yourself quickly escalated. Talk about that if you
Yeah.
don't mind sharing.
Yeah, so I had a very low risk pregnancy. Looking back now, there were some small indicators that preeclampsia could develop, but they were obviously not picked up by my healthcare provider. And when I started to show real signs of preeclampsia, like rising blood pressure, rapid weight gain, which indicated that there was a lot of swelling going on, and I was actually spilling protein in my urine, which means that there was some kidney involvement. Um, my healthcare provider really just said, oh, all these things could be normal during pregnancy and we'll see you next week. But later that night, luckily I have a bit of a clinical background. So I was monitoring myself at home, checking my blood pressures and ensuring that I was, remaining safe in my pregnancy. And I noticed that things continued to decline. And so I went to the hospital and it was determined that I had severe preeclampsia. My daughter was delivered via emergency C-section early within an hour of arriving, and she had a bit of a NICU stay. And I have long-term health consequences because I had this missed diagnosis. And I saw my clinician early that morning, and had I been delivered or began to be treated earlier in the day, I wouldn't have progressed into the severe form that I had. And the scary part is if I went to bed and hadn't had that clinical background and knowledge, chances are, I could have had a stroke in my sleep and never woken up, and that would have been the end of
Oh,
my
heaven
story.
forbid.
And
Heaven
that's why we're
forbid.
in the position that we're in. Yeah, it's really scary and traumatic.
Leah, is an emergency C-section always done when you are diagnosed right there and then? If they see your blood pressure going up right away, is that what's usually done?
No, not always. It's if is organ involvement and you're at high risk for essentially bad things happening, and you're not towards the end of your pregnancy where, say, an induction for vaginal birth would be safe, then yes, they would of course do a C-section. But sometimes there's a more mild form of preeclampsia as it begins to develop, and if they identify it early, sometimes they can do some things to support you and continue the pregnancy a bit longer, especially if there's a risk for the newborn to be delivered too early. So there's this waiting and watching period that can occur, but most of the time, by the time it's caught, it's a little bit late. And so
Mm.
usually delivery within the next, few hours is what needs to be done to make sure that everybody remains safe.
So now in New Jersey, there are several bills in committee about preeclampsia evaluation mandate, et cetera. What
Yeah.
does this mandate require?
Yeah, so there's three things, and they're actually very strategic. One of them is it's a bill that was introduced that would ensure that insurance companies must provide reimbursement for at-home blood pressure cuffs, because believe it or not, it's such an easy way of identifying if preeclampsia will be developing. But for some reason, insurance companies do not cover the cost of a home blood pressure monitoring device. And furthermore, they do not incentivize or provide reimbursement to providers to educate patients to review the results of what the even when women are monitoring at home, they don't. There's no incentive for the doctors to really pay close attention. And in a healthcare system that is overrun, we have maternal health deserts where OBGYN offices are closing just across, especially in New Jersey, across the state. Two of mine in the past year have closed, actually. So there's this lack of monitoring and attention. And so this bill would mean that insurance companies have to reimburse for the cuff itself, education, and then the provider for the work that they do to
And we're
monitor.
down. I need to cut you only because we're down to like 10 seconds. I'm just going to
Sure.
quickly mention you're also talking about a blue band, right? So in an emergency situation, a woman who's pregnant, that identifies the woman as having
Yes.
preeclampsia, correct?
Yes,
So
exactly.
that's a brilliant idea. So and talk about
Yes.
NeoPredics has near
Yes.
predictive technology too.
Yes, please check it out. It's called Pre-Free. It's a tool that can identify women who will develop severe features of preeclampsia. So if we can use predictive medicine, it really eliminates a lot of the guesswork that causes poor maternal outcomes. So we're really proud of that. It's already live in Europe and on the market. We're already using it on patients, and we're working on our FDA approval now, which we will secure by the end of the year and start using it on patients here in the United States and protecting women like myself and our family and friends from preeclampsia and the severe outcomes related to it.
Save our moms and our future generation, please. The website neopredics.com, neopredics.com. We're talking about preeclampsia. If you're pregnant or know somebody who is, you need to know about it. Lia Butler, Director of Sales, Marketing, and Business Development for NeoPredics. I'm glad you're healthy and with us. Thank you
Thank
for
you.
coming on this morning. You
Thank you,
bet.
Ken.
Thank you.